Hello, my name is Nurse Paige, and today I will be covering the medical diagnosis pneumonia. I will be talking about what pneumonia is and how I would treat a patient with pneumonia. So pneumonia is a lung infection that can range from mild to severe that most of the time you have to go to the hospital for if it's left untreated. It happens when an infection causes the air sacs in your lungs, otherwise known as alveoli by doctors, to fill up with fluid or pus. So your lungs are going to fill with fluid or pus, and it's going to make it hard for you to breathe properly. In turn, you won't be able to breathe in enough oxygen to supply to your bloodstream, so that can lead to major complications, which we'll get into later. There is primary and secondary pneumonia. Primary pneumonia is caused by the patient's inhaling or aspirating a pathogen such as bacteria or a virus. Bacterial pneumonia often is caused by a staphylococcus, streptococcus, or Klebsiella. Usually occurs when the lungs' defense mechanisms are impaired by such factors as suppressed cough reflex, decreased cilia action, decreased activity of phagocytic cells, and the accumulation of secretions. So there's many factors that can cause pneumonia. So viral pneumonia occurs when a virus attacks bronchiolar epithelial cells and causes interstitial inflammation and desquamation, which eventually spreads to the alveoli or air sacs. So it could be bacterial or viral. For a secondary pneumonia, it ensues from lung damage that will be caused by the spread of bacteria from an infection elsewhere in the body or by a noxious chemical. So pneumonia can either stem from bacterial infection that's already somewhere else in your body, or it can also come from a toxin that you breathe in the air. So those are different ways of acquiring pneumonia. There's another type of pneumonia called aspiration pneumonia. That's caused when the patient inhales foreign matter such as food or vomitus in the bronchi. Factors associated with aspiration pneumonia include old age, impaired gag reflex, surgical procedures, debilitating disease, and decreased levels of consciousness. So if you aspirate something into your lungs, that can also cause your lungs to become infected and fill with pus or secretions. And then there's walking pneumonia. You can get walking pneumonia in either one or both, or you can get any kind of pneumonia in one or both lungs and your right or left lobes. The causes of walking pneumonia are bacteria, viruses, and fungi. If your pneumonia results from bacteria or a virus, you can spread it to someone else. Some risk factors associated with pneumonia is infants younger than 2 and people over 65 are at a higher risk because they're immunocompromised. Their immune system may not be strong enough to fight it. Cigarette smoking can be a risk factor. Recent viral respiratory infections such as the common cold, laryngitis, influenza, difficulty swallowing due to things such as a stroke, dementia, Parkinson's disease, or other neurological conditions. Chronic lung disease like COPD, bronchiectasis, cystic fibrosis, those kinds of lung diseases can also cause pneumonia. Cerebral palsy, other illnesses such as heart disease, liver cirrhosis, or diabetes mellitus. Living in a nursing facility can also be a cause of pneumonia because elderly patients tend to get it more frequently. So if you're in a nursing home, it's easily spread. Impaired consciousness, so loss of brain function due to dementia, stroke, or other neurological conditions. Excuse me. Recent surgery or trauma, immune system problems. So these are all risk factors associated with developing pneumonia. An assessment that your doctor will start out doing is asking you questions about your symptoms and your medical history. like whether you smoke, whether you've been around sick people at home, school, or work. Then they'll listen to your lungs, so they'll auscultate your lungs. If you have pneumonia, it's common for a doctor or a nurse, such as myself, assessing a patient, to hear bubbling or crackling or rumbling sounds. If you hear any abnormal sounds when you're auscultating your patient, then you know that they are not breathing properly and their respiratory system's not working efficiently. This can be a sign of pneumonia. Your patient may also have chills, elevated temperature, pleuritic pain, rhonchi and wheezes, use of accessory muscles for breathing, cyanosis, mental status changes, and sputum production. So you want to pay close attention to all of these signs and symptoms whenever you're assessing your patient. As far as a psychosocial assessment, the way that nurses do this assessment for their patients is they want to first identify the patient, the chief complaint. So it'll be like how the patient explains how they're feeling. So when they explain that, that'd be the chief complaint. The history of presenting illness. So you'll want to know their illness history, psychiatric history, medical surgical history, medication list, alcohol or drug use, violence risk assessment. So you'll have a list of steps to take when you're checking for their violence risk to make sure they don't want to harm themselves or they never have in the past. Family social history, occupational history, educational history, legal history, developmental history, spiritual assessment, cultural assessment, financial assessment, coping skills, interests and abilities, and the mental status examination. So you'll want to run through basically the patient's their personal life, their work life, their spiritual life, their culture, kind of basically getting a background all about your patient so that you know maybe something can tell you how they develop pneumonia or anything else that you need to be paying close attention to while they're under your care. Lab and radiology diagnostics. So whenever you have a patient with pneumonia, you're checking to see if they in fact do have pneumonia and how they got it. You'll want to run blood tests to look for signs of bacterial infection. You'll want to take a chest x-ray to find the infection in your lungs and how far it's spread. You'll use a pulse oximetry to measure the level of oxygen in their blood. A sputum test to check the fluid in their lungs for the cause of infection. If the symptoms started in the hospital per se, or you have your patient has other health problems, then your doctor might give them more tests. Some of these tests include an arterial blood gas test to measure the oxygen in a small amount of blood taken from one of your patient's arteries, bronchoscopy to check their airways for blockages or other problems, a CT scan to get a more detailed image of their lungs, a pleural fluid culture, in which the doctor removes a small amount of fluid from the tissues around their lungs to look for bacteria that might cause pneumonia. So this just gives them a more detailed look to figure out how to treat the patient in the most effective way. Some complications that can occur with pneumonia are bacteremia, in which bacteria spread into the patient's blood. This can cause septic shock or organ failure. Trouble breathing, which might mean that you need to use a breathing machine on your patient while their lungs are healing. Fluid buildup between the layers of the tissue that line your lungs and chest cavity. The fluid can also become infected. Lung abscess is when a pocket of pus forms inside your patient's lung. Respiratory failure, this is one of the worst case scenarios, which require a breathing machine or ventilator. Sepsis, another really bad complication, is a condition in which there's uncontrolled swelling or inflammation in the body, which may lead to organ failure. As far as medications, the medications that are prescribed to your patient with pneumonia depends on what kind of pneumonia they have. So if it's from a bacterial or if it's viral. If it's a bacterial infection, then more than likely they'll be prescribed antibiotics. Some initial antibiotics that are typically prescribed for patients with this condition would be macrolides, including erythromycin, azithromycin, roxithromycin, and clarithromycin. These are some of the antibiotics. Macrolides provide coverage for likely organisms in a community-acquired bacterial pneumonia. Other antibiotics that you may prescribe your patient would be penicillin G for streptococcal pneumonia, nafcillin or oxacillin for staphylococcal pneumonia, aminoglycoside or cephalosporin for Klebsiella pneumonia, penicillin G for clindamycin for aspiration pneumonia, and then the list goes on with alternatives, but those are the most common. Some nursing interventions that I would do with my patient. I would administer oxygen as prescribed, monitor respiratory status. So you want to consistently monitor their respiratory status to make sure that they're breathing okay. Because if they're not getting enough oxygen to their cells or to their body, this can cause shock and organ failure. Monitor for labored respiration, cyanosis, and cold and clammy skin. I want to encourage coughing and deep breathing and use of an incentive spirometer. I want to position my client in a semi-Fowler position to facilitate breathing and lung expansion. In some cases, you want to put them in a high semi-Fowler position if they're still having trouble breathing or they're coughing a lot. Change client's position frequently and ambulate to tolerated to mobilize secretions. So ambulate them just a little bit. They'll be super tired from pneumonia, but you want to get them up and moving somewhat each day so that they can get their secretions flowing and try to get some of that out of their chest. Provide CPT, perform nasotracheal suctioning if the client is unable to clear secretions, monitor pulse oximetry, monitor and record color consistency and amount of sputum, provide a high-calorie, high-protein diet with small, frequent meals, encourage fluids up to 3 liters a day to thin the secretions unless contraindicated, provide a balance of rest and activity, increasing activity gradually, administer antibiotics as prescribed, administer antipyretics, bronchodilators, cough suppressants, mucolytic agents, and expectorants as prescribed. Prevent the spread of infection by hand washing and proper disposal of secretions. So you want to try to prevent that. And then for the patient teaching, before you allow your patient to leave the hospital, you want to be sure the patient understands all medications, including dosage, route, action, and adverse effects. You want the patient and family or significant other need to understand the importance of avoiding fatigue by limiting activity and taking frequent rests. So you don't want to push them too far. You just want to let them get a little bit of movement in each day because they'll be super fatigued. Advise small, frequent meals to maintain adequate nutrition. They're not going to have a huge appetite, but you're going to want them to have small meals and frequently so they can get better. Fluid intake should be maintained at approximately 3,000 milliliters a day so that the secretions remain thin. Teach the patient to maintain pulmonary hygiene measures of coughing, deep breathing, and incentive spirometry at home. Provide information about how to stop smoking. So if they're a smoker, you want to try to get them to slowly quit that because that could have been a cause of pneumonia, and it will only make it worse if they do have it. So that is all on pneumonia. Thank you.